Here's the paradox. In healthcare, we spend trillions of dollars trying to get people to act and fail. Yet outside of healthcare, every day companies get us to eat when we're not hungry and buy things we don't need. I know I spent 2 decades at the largest consumer companies in the world driving behavior change. So the question isn't, can humans change behavior? The question is, why does healthcare keep getting it wrong? At Engages, we've proven that bringing the outside in works. We've helped the nation's largest health plans drive cost of care reductions, resulting in hundreds of millions of dollars saved annually. We have doubled screening rates and increased STAR measures. We have improved retention, all the while optimizing the experience, satisfaction, and trust. Prior to healthcare, I helped companies like Procter & Gamble and American Express drive outcomes. During that time, I found a passion for using data, behavioral science, and agile A/B testing to unlock the secrets of behavior change, not just for an individual, but at scale. Back in 1999, we were building early consumer data platforms and enabling machine learning that would allow us to treat a consumer as a true N of one, driving an individual's next best action. So when I walked into healthcare, I could not believe we were not adopting the principles that have been proven for decades to drive behavior change. And that's when I realized something shocking. Healthcare has more data on individuals than any other industry on earth, but almost no idea how to use it to change behavior. My former Cheerios brand manager self would have loved this much data on my consumers. The lack of know-how is revealing itself in an even greater way today, as the race to build an AI-enabled experience accelerates. AI doesn't replace know-how, it exposes who has it. But information alone doesn't drive behavior. You need context. Behavior is driven by friction, timing, emotion, motivation, and environment. And it's cumulative over time. So if you are not intentionally building the experience, then most certainly you are unknowingly breaking it. And the sum of each and every interaction in that experience becomes your brand. In consumer industries, we design for those forces. In healthcare, we ignore them and then blame the consumer afterward. The amazing part, when we help organizations adopt these systems, principles, and technologies, not only do they realize exponential results, but consumer satisfaction also increases. Why? Well, in the words of the consumers who write in after we have guided our clients to greater consumer centricity, we hear, "I finally understand what you're asking me to do. Finally, you know who I am. I can't believe I never knew what an EOB was until now." On these types of interactions, trust is built. The future of healthcare won't be built by telling people what to do better. It will be built by designing systems that make the right behavior the easy one. The results are not incremental, they're massive. We've seen organizations unlock hundreds of millions, even billions in savings by changing how they engage with people, not how they lecture them. We are spending more now on healthcare than ever before and still getting sicker. AI will not fix this. New drugs will not fix this. More data will not fix this. Not unless we learn how to change human behavior at scale. The secrets of health engagement were never hidden. They've been working all around us in retail, in media, in consumer goods for decades. The future of healthcare won't be built in hospitals. It will be built around human behavior.